the second trimester is when the journey started becoming a little bit tough.
Yeah.
My body started swelling. My heartbeat changed. I could not sleep well. So that is when she told me that I've started suffering from preeclampsia.
I was a bit tensed because, in fact, the day I took her to the hospital, she was not even conscious. She was like unconscious.
Hello there and welcome to this show. My name is Frida Wasonga. I am very happy to host these parenting conversations today. I would like to say that we are shooting this video in Grace Hill Mission Church. It's a church in Dogoto, Kikuyu, Kiambu County. And here we believe that God writes beautiful stories. I am so pleased to host a very beautiful couple this day, Christine and Hargreaves. Karibuni sana on the show.
Thank you.
And we will be hearing about their parenting journey as they talk to us and also as we learn from each other. So welcome. You can greet us and introduce yourselves.
Hello, my name is Christine Adhiambo. I'm married to Hargreaves and I'm very happy for this day. We are about to talk about parenting and I'm so eager to share my experience as a mother and as a wife. Thank you.
Okay.
Yeah, I'm Hargreaves Marotse, married to Christine, and we have one baby at the moment.
Yeah, at the moment.
Yes.
Yeah. Okay, so karibuni sana.
Thank you.
So you've not told us what you do. Maybe you can talk about your work.
I serve in church in a number of areas. I do media and sound. That is whereby I manage sound, and I also do media in terms of streaming and also community work. That's reaching out to the community around the church, specifically the children around the church, mentoring them, encouraging them, giving hope to those who are hopeless. Also helping those who are demoted in terms of education, so we motivate them. Where need be, we pay school fees. And I assist in administration. I did administration for a long time, and then after that we trained someone who is now fully doing administration. But because of the background, I still do a lot of administration. And also logistics around that area. Those are basically what I do, and many other things. Yes.
Okay, Christine, what do you do?
I'm a teacher by profession. I deal with small kids, and I love my career because it trained me before I became a parent to do this as a good mother, as a parent. Yeah, through my career I've developed that. So that is my profession. I teach. Yes.
Because also as teachers, I'm also a teacher. We actually refer to the students as my children. We call them, my children have not done this and this. My children have not eaten.
Yes.
So it gives you a lot of love.
It trained me earlier before I became a parent or before I became a mother.
You can take us back to when you were married and how long you stayed before you had a baby.
We got married in September, September 17th, 2022. Yes, just here in church. Yes, it has been now 2 years and few months. 2 years and a number of months. And we got our baby after we conceived after 6 months.
After 6 months.
Yes.
So, okay. So 6 months after the wedding, we noticed that we are pregnant.
Yes.
So what are some of the changes you experienced in pregnancy?
Okay, first and foremost, what I can share about us conceiving. For sure, it was not planned.
Oh,
Funny enough, it
yeah.
was not planned.
How long were you to wait?
We were waiting for it to come, maybe after 1 year.
Okay.
Yes,
Yeah.
after 1 year.
Yeah.
So, through waiting, the process, through that process is when we realized that we got pregnant.
Yeah.
Within those 6 months. The fact that we were not supposed to get pregnant by that time, we were still using contraceptives, sorry.
Oh, okay.
And also my working schedules was really discouraging me from maybe getting a baby as early as I had planned. So my journey wasn't planned, but we thank God,
Yeah.
because God is the one who gives us time to be parents.
Exactly.
Yes.
Children are
So
lucky.
we appreciate the fact that we didn't plan for her to come, but we are celebrating her.
Yeah.
Yes.
Yeah, because it was actually not your hand.
Yes.
It was God's hand.
God's hand.
Yeah.
Yes. Yeah, and we really thank God for her. Yes.
So, Hargreaves, how did you react when you were told, hey, they are expecting?
I think before I reacted, because it was the first time,
Yeah.
we were not sure. So we called friends. Before we called friends, friends told us to do some tests.
Yeah.
We did the test first
So,
time.
okay, you suspected that you expect them?
Because we suspect, we were not sure, in fact, we were
Yeah.
just told do these tests. Then when we did the test for the first time, it was positive. I was happy,
Yeah.
but my wife was not like, this is not true. So
Yeah.
we did it again. I think we did like 3 times.
Yeah.
And then so we called friends, and the friends celebrated with us. And so I was also very happy, because for me, as much as we were planned to have a baby in 1 year,
Yeah.
I was eagerly waiting for that.
Yeah.
So when that time came, I was very excited,
Yeah.
and not knowing what to do, because that's the first time.
Yeah.
Yes.
Yeah. I think is it a man's thing to be ready for a baby? I think immediately you get married, you're just ready for, like, you don't hear a man saying, no, we don't want a baby now. Is it a man thing to always be ready for a baby?
I can't really say. I think so,
Yeah.
because for me, I was excited and I was ready.
You are ready.
Yes.
Okay.
Ready for the news.
Yeah. So you said that you noticed. Okay, you said that you called friends and then they advised you to take a test.
Yeah.
So what made you notice that she could be pregnant? Is it that she was getting unwell or?
No, she had missed her periods
I see.
for a long time, and we got worried. Why are they not coming?
Okay.
So it was like, this is the second month. And like no sign, no word.
Yeah.
Yes.
Oh, I see. Okay, and Christine, now here you are, disappointed at your contraceptive.
From my side, I had to accept the results.
After 3 tests.
Yes, after 3 tests. But still I was doubting.
Yeah.
So that is when I think we went to the hospital.
Yeah.
Because I didn't believe that that kid was saying the truth.
Yeah.
I was like, how comes, and I was using
those
those pills. How comes they have not worked?
Yeah.
So it is when we took ourselves to the hospital, and that is when I started believing that this thing is true.
Yeah.
But in one way or the other, through the encouragement, through talking to people, my friends, they encouraged me that the journey it's tough, but you will have to accept in whichever way.
Yeah.
So through the talks and the encouragements, I I was happy.
Yeah.
I was happy.
So you went through the 9 months.
Yeah.
So how would you describe your pregnancy journey?
Okay, my gestation period, the first trimester was very okay, but I developed the normal changes that one experiences when she's pregnant. So I was told earlier that these are the things you are expecting to experience. So I had set my mind like vomiting, morning sickness, nausea.
You were ready to vomit?
Yeah, I was ready to vomit. So I was not doubting myself that why should I vomit?
Yeah.
Because I was told earlier those are the experiences. So, and then the second trimester is when the journey started becoming a little bit tough.
Yeah.
I was like, I'm not seeing like my womb growing somehow. And I started experiencing maybe some signs and symptoms of maybe something is wrong with my gestation period. I started swelling, my body started swelling, my heartbeat changed, I could not sleep well. Then I've just shared that I'm a teacher. One of the parents just took a look at me and asked me, teacher, I've noticed something very different from you. The swelling and the change in your body. Do you mind if you go to the hospital at least for a checkup? Because it could be you are suffering from high blood pressure. And I know you are pregnant, so it's good to take the precaution and go to the hospital. And I shared with my husband, and that is when we started going for a regular checkup. And when we were going first to St. Odilia's Hospital, but now we were advised to go to at least a bigger hospital. And we took a step to Kikuyu Hospital, and that is when we started taking the journey of
regular clinics.
Yes, regular clinics. Then we were referred to a gynecologist. So that is when she told me that I've started suffering from preeclampsia.
So it's the gyna who told you?
Yes,
So
it's the gyna who
when you went
told
to
me.
the clinic in St. Odilia's, did they notice anything with your pressure?
They noticed, but they weren't that clear. That is why. That is when they referred me to Kikuyu Hospital.
And Kikuyu now, that's when they.
Yeah, you know, you see, like a gynecologist is somebody who is specialized with that process of maybe getting the child. So that is when I was told that it's not normal, the swelling and the changes. And now the gynecologist also advised us to go to a bigger hospital again, which is Kijabe. We were supposed to either choose Kijabe or Kenyatta. So by that time my mind wasn't sober.
It was all over.
Yeah, that was now I was nearing to the 3rd trimester, and I was really tensed. That is when I started asking myself, are things going well? How will I survive? Will I really survive together with my baby, the baby I'm carrying? Because I really experienced difficulties. And I was like, when the doctor asked me, that is now when we were now admitted to Kijabe, the doctor could ask me so many questions like, have you had the movements of the baby, the kicks? And I was like, what are those? I didn't hear anything like movements. So they also got tensed. And
because at 2nd trimester you're supposed to feel some kicks.
Now we were almost in our 3rd trimester now. So through those talks, even the doctors commented that things are not well here. I was really tense, But now they had no option than just to advise me to get an early delivery.
Before we get to the early delivery,
yes,
maybe there's someone wondering, what is this preeclampsia?
Preeclampsia, I was told that it affects the pregnant women who have high blood pressure.
Yeah.
Yes, if you get high blood pressure during your delivery.
During pregnancy?
Yes, during pregnancy,
yeah,
it's when you suffer that preeclampsia. Yeah.
What are the signs to look out to when you have preeclampsia and maybe you don't know?
What I experienced, I wasn't breathing well. I wasn't having good sleep. And also the eyes, the sight. My eyes, I wasn't seeing clearly.
It was blurred.
My vision was
blurred.
Yes, somehow it really changed. And yeah, those are the difficulties that I could say somebody can experience during swelling. Yeah, and the swelling, yes, that is in fact is one of the main things.
So where were you swollen?
The whole body actually.
The hands,
the legs, maybe the stomach, you know it.
The face,
the
right?
face,
yeah.
It was just open that somebody could notice something is wrong with my body.
Okay.
Yeah.
So maybe we can hear from Dad. When of course you were going to hospital with her, when you heard the news of preeclampsia, what happened to your mind? How did you feel?
Okay, I think before that, one of the things that maybe I really appreciate because of now the friends and their accountability, being our first journey, we knew very little.
Yeah.
And so we were like, maybe this is normal. But after a lot of friends, I think also, I not really think, you are one of the people who told us this is not really okay. No, you need to go to the hospital. And because of that, the circle of friends we had, we were able to take the correct measures in the right time. So for me, when I heard the news, because I could not even understand it clearly, because it's the first time, so I could not even know the really implications. But through doctors and friends, I was a bit tensed, because in fact the day I took her to the hospital, she was not even conscious. She was like unconscious, because I had to call a friend very late in the night, around 2 a.m. And because she was not okay, I could not feel even the baby, nothing. So I called a friend who responded very fast. So we came. In fact, for her, it was the following day when she realized that now I'm in the hospital. And yes, when we were going to the hospital, my mind was like, where? I was even not counting that the baby is there. So it brought a lot of fear, but when we went to the hospital, and we were attended to very fast. In fact, she was taken in, and we did the registration later. And that's one of the things that I appreciate about Kijabe Hospital. They just took her, and the procedures continued, everything. Then we came and did the registration and payment later, when she was a bit now stable. And that one brought fear and a bit of anxiety and confusion. But after I think 4 hours, about 4 to 6 hours, we were told she's okay. But now also the baby is okay. But the doctor tried to make the process at least take long, but now they told us we need to be ready because anything now can happen. Yeah, so the process went very fast. After 2 days, that was when she was rushed to the theater. Yes. And it was really an emergency because I was there. And so after just a lunch break, it was around 12.
Yeah.
And so it was now the visiting hours are almost over, so I was out. And immediately I'm called in, and she's already in the theater. So it was that fast. And then after a few minutes now the baby came.
The baby was
around 1.
Yeah. Oh.
Yes.
It was indeed fast.
It was fast because she was doing some just outside, taken to the theater very fast. And then around 12, so by 1, the baby is out, but she stayed in the theater until 6 in the, not say yes, 6 p.m. The recovery.
Yeah.
The baby came, but she was in the theater until late in the evening. Yes.
Okay.
And in these journeys, one of the things that I really thank God and celebrate is that I had people praying with us.
Yeah.
Even our pastors visited and friends. So during that time, when my wife was in the theater, I had friends. My pastor had came with friends. I had around 4 people around me, just encouraging me, and they waited until she was out of the theater.
Yeah.
And then they went also, they said hi. Yeah.
Wow.
So it is confusing, it's a lot of anxiety, but you have people around. That is one of the things that kept us encouraged. Yes.
Okay.
Yeah.
So Christine, now that you are in the ward, and then Hargreaves leaves and suddenly you're going to the theater, is there something that happened that had you to be rushed so fast?
Okay. Actually, what made the emergency CS to happen? The doctor came and examined me, and realized that things were not okay. From the heartbeat, from myself. That is when she suggested that we should go to the emergency theater. That is emergency CS. So that is what happened. Considering the doctor came and got me, I wasn't okay. That is why the doctor took the step of rushing me to the theater. Yes.
That means the pressure was not going down.
Of course the pressure was very high, and also the doubts of the heartbeat.
Of the baby.
Of the baby.
Yes.
The baby. Yeah. So it was at a very high risk. Which led now to the emergency. Yes.
Okay.
Yeah.
All right. So the baby is born.
Yes.
So what happens next?
I saw the baby rushed, and so I went to the NICU.
Okay.
Yes, and then I saw the baby. The baby was prepared, and then from there, she was put in the incubator.
Yes.
So because the baby was born at how many weeks?
She was born at 30 weeks.
Yeah.
But yes, that is and with a very low weight of 1.2.
Yes.
Yes.
Yeah.
1.2 grams.
Yeah. So she was taken to the incubator.
Yes.
You were able to see her in the incubator.
Yes. Yes. I was able even to see her before the incubator. Yes, and then so she stayed there. She stayed there in the incubator for about a month.
Okay.
Yes. Then from there, we went. There are processes. From the incubator, you go to kangaroo mothers.
Yes.
We stayed in the hospital for about 2 months.
So by that time, you're not even going home. You have come to.
I had to home hospital. She was the one who was still in the hospital. Yes.
Okay. So how was that journey, Christine?
From my side, it was a very tough journey, and considering I got an early delivery, the processing, the process were very tough for me. Like you have to to consider going to see the baby for like after 2 hours, 3 hours. Sometimes you don't have milk, and you know with the preterm babies, they are not like breastfed like immediately.
Okay.
So you have to express milk, and then after expressing the milk is when you go to feed them with through NG tube. I don't know, but okay, now you can't understand the NG tube for now, but it is a certain tube that is fixed maybe through the mouth or the nose, and then you are taught by the doctor or the nurse on how to feed the baby. Yes, you use a syringe, and then that is when you start learning as a mother. Although it's hard because sometimes you are told to express a certain amount of milk, and maybe you don't have, and maybe sometimes you feel so drowsy, sleepy, you are tired, you go feeding the baby, the milk that you have struggled to look for, it goes all pouring down. I'm like, okay, you are going back to the zero. So it wasn't that easy, but now my husband has just shared that the baby came with 1.2 kgs, and now considering the processes that you need to follow, like that incubator, for the baby to maybe to come out of the incubator, she's supposed to or is supposed to meet a certain level of kg, like maybe 1.5 or 1.6. So it was somehow a challenge, because sometimes the baby could add the weight, sometimes goes down. So for you to meet that 1.6 or 1.5, you have to sweat, you have to have a lot of work. So the moment we heard that we were 1.6, 1.5, and we were told that we are going to the next step, that is the kangaroo mother's care, we were so excited. So that time the doctor came and told us, now at least you have achieved your goal of meeting the weight that we were expecting. Now we will have to take you to another step called kangaroo mother's care. Hey, this kangaroo mother's care also, it's not easy. It's whereby you take your baby and the way, let me say she was tiny.
I can imagine
1.2 with 1.2. Oxygen, and then she's delicate because she wasn't breathing on her own. She was using oxygen, so you have to carry her like...
So the oxygen is also a tube?
Another tube, and also she has another tube for feeding, that is NG tube. So when you are told to handle this baby with a lot of care, and maybe put her inside your dress, you have to be very careful not to hammer in any way,
not to disconnect
the pipes. So we had to do it because we were counting days, when will we come from this hospital. So we had to do our best as mothers. And of course, I wasn't alone. We were so many mothers there who suffered the preeclampsia, who suffered preeclampsia. So we used to encourage ourselves. We used to pray together. Also, the good thing about Kijabe Hospital, there are times when people come, they encourage you, you share the word together.
Or the hospital staff?
Yes, the hospital staff. So those are the things that kept us moving, and finally we made it. So I was talking about the kangaroo mother's care step. So also that one, we were given a certain kg for us. A certain weight, a certain weight for us
the baby needs to achieve.
Yes, the baby needs to achieve. So I also did my best as I managed the NICU process. It's the same effort I also applied in kangaroo mother's care. And by that time, I can't really remember the kg, but we weren't two. Even when we were being discharged, we weren't still two. So it reached also a time, we were also told that we are going now to the third step. now the final step, of which now we could now maybe the baby, you know, wasn't even wearing clothes and whatever, and now that with the third step, we were even allowed to wash them and even to maybe clothe them.
So now
so
they're
it's
off
the
tubes.
they're off tube, but we were still using oxygen. We were still using oxygen. And now also with the third step, it is where we were weaned off from the oxygen. The baby started at least breathing on her own. And that time, that's the time that I really celebrated. And now the doctor comes and tells me, now, any time from now, you will go home with your baby. So that time the doctor comes, removes the oxygen from my baby, and now the oxygen reads above 80, and she used to maybe breathe at 60, 70, which was very risky. But now, this time around, one day, the doctor just comes and plugs out the oxygen, and the oxygen reads 80. We were really happy about it. Joy, the joy came in our hearts. I even shared with my husband. I even called, and also from his side, he was really happy. So the following day, we also tested her without the oxygen, and for sure, it improved. Now this time round, it was above 85. So, and that is how we weaned off the oxygen, and the baby started now surviving like the normal baby now. It was very happy.
So at what point did the baby start breastfeeding on her own?
During the kangaroo mother's care.
That's when
that is when now the person in charge of teaching us how to breastfeed, because I'm my first time, I even don't know. By that time, I wasn't even aware of how to handle the baby and start breastfeeding her. So, but during the time of kangaroo mother's care, that stage now is when one of the doctors, or no, not the doctor, but the nurse in that department, is the one who taught me on how to breastfeed the baby. That was at 1 month, 3 weeks to 1 month now. Yes.
All right. So, Dad, so you just hear the progress. The baby is now not feeding anymore on the tube. There is now the kangaroo mother's care stage, and then the third stage. How are you now at that point?
Of course, I was very, very excited. Because I could, the way she's saying, she could, one of the things that was really hard for her, she could not rest, she could not sleep. Because after every 2 hours, you are supposed to go and feed the baby. And that 2 hours, it includes, there is time for preparation. You need to go to wash those things after every 2 hours. So it was a bit hectic for her, and also for me, because she could call me now, this is the time. So we were together in the journey. But one of the things that she has said that I really want to add on is what really kept us going, in spite of that challenge, was I think when you started, you said this Grace Hill Mission Church where God writes beautiful stories. And one of the things that I have been in this church for more than 10 years. For more than 10 years, that's about 13, 14 years. And one of the things that I can say about our church that really contribute to what kept us going is the family aspect, the supporting aspect. Because for me to be able to go to Kijabe, like I used to go like every day, almost every day, go back. In a week, at least 4 days I have to be in Kijabe and back. And I have to, most of the time I had to spend there. The expenses and all that. People could support me. People could give me transport. People could pay my transport. People could pay my my stay there.
Yeah.
And on top of that, people could visit regularly to go and encourage her. I am sure for those 2 months, I'm sure there is, you can't say, like in a week, we used to have at least 2 people will go visit from here. Even our senior pastor, we could go and visit. Our senior pastor visited more than once. Pastor Robert, Pastor Grace were the first one, together with Loco and Kavila to come. So those are some of the things, despite this big challenge, those are the things that really kept us going. And we were grateful. Our friends, Kina Victor, as in the circle, the family aspect in our church and the circle of the friends we have really kept us going. And the burden was lighter because of
carried
that.
The burden for you.
Yes, people prayed for us. I think we'll talk it maybe later. People supported us because the baby staying in the incubator at those times, there are also implications in terms of finances implications. Yes.
Okay, so now Christine, back to you. I'm imagining a CS mother who can barely walk, you know, after the operation, and now you have to to walk. I'm imagining also the incubator is not next to your bed. So you have to walk every 2 hours, to and fro, maybe to the sink to wash the utensils. How was your healing? The physical healing, even before we talk about the healing of your heart.
Yes. Okay. From what I experienced, it wasn't easy for me. I kept on encouraging myself that the fact that I had set my mind I had to do them, I didn't know even where the strength came. So I experienced difficulty in physically, but now I had to keep myself strong. Even when the pain came, I even assumed that I'm not feeling anything for the sake of achieving the goal that we need to come out of this hospital. So I could feel pain, but set my mind now, if I soothe myself, or maybe if I don't do this, this will happen. I kept on keeping myself strong. If I feel pain, I could now talk to the doctor or the nurse, and then she does the necessary thing, and then I keep the painkillers and the whatever kept me strong, and even encouraging myself.
So now we are out of the hospital, 2 months later. So how do you transit now back to the house?
Now, the fact that we have shared that we had good friends, and people were really looking, eagerly following the process. So we weren't that like zero. And also I had called somebody maybe to shop for me. And also I just got a shock. You know, that time when we were discharged, now we came to maybe at home. That very same day, friends from church, Akina Jackie Selim, Akina Kavila, came to me with a bag full of clothes. I was so happy. So it was just like a gift to me, the things that I needed. Also, at that time, I wasn't also ashamed maybe to ask for something or from my friends, because you see now I'm from the hospital. I can't like go by myself to shop, and even you see with men, they can't like maybe meet your level of your need for your baby.
He might buy blue clothes for
he might buy blue clothes for the girl. Now also not ashamed that I need help. So through that, I asked for help, and also the surprises that I got is what made us to meet the needs of the baby. Through the support, and also through asking for support. Yes.
Okay.
Yeah. And also with the preparation of now bringing the baby now to the house, I had a day back help whom I had informed my husband at least for her to prepare the house.
Okay.
Yeah, to do some cleaning and even maybe the things that are needed for welcoming the baby in the house. So my help helped me, yes, and also the friends who are ready for me.
Wow.
Yeah.
Okay.
That is how I managed.
Yeah. So Hargreaves, here we are. The baby needs to be washed, to be changed. It's your first time as a father. Do you jump on these roles or you leave it to the mom?
I think the good thing, I think we say it because that's the fact.
Yeah.
We were taught by our friends.
Ah.
Yes.
Wow.
Kina Kavila, the one that she has mentioned.
Yeah.
She was even, apart from being taught in the hospital how to breastfeed, she was also taken good care of by those ladies.
Yeah.
They showed her how to wash. They even brought the basin. They brought the soap. They taught us.
Yeah.
Yes.
Yeah.
So it was not really a big struggle because we were shown the way from when we came back home.
Yeah.
Yes.
And by the time the baby is being discharged, how many kgs is she?
She was
1.95.
yes.
So she's still tiny.
Yeah.
Yes.
Okay.
Of course, we were instructed by the doctor that this and this needs to be done at home. Like, we don't need to expose the baby. Yeah, we don't need to the main thing was not to expose the baby. The care that she used to experience in the hospital is the same that we are supposed to apply at home. Yeah. So we took those steps and she kept on growing. Yeah.
Wow.
Following the doctor's instruction. Yeah.
And now you have enough milk? By that time?
Yeah, of course I had started struggling with milk. Now we had no option than now to switch into the NAN. But now it was quite expensive.
Yeah.
But now as we had set our mind that there are some things we just had to do them.
Yeah.
Like, when we put our mind that the whatever is expensive for us and this, we couldn't make it up to this time.
Yeah.
So we had to buy it, like, at least to top up from what I had. Yeah, because by that time I didn't have enough milk. Yeah, I think because of the struggles, the stress, so I was a little bit struggling with the breast milk. Yeah.
Okay.
Yeah.
All right, so now we come to naming the baby. What informed the name that you gave your beautiful baby girl?
Okay, I think I'll take up that one first.
It's like it's your idea.
Not really my idea, maybe at the end. When we got married, and then we still do, we used to do, we do devotions together, reading the Word of God. So when we were reading the Word of God, one of the objective we had was, let us try to find for a name.
Yeah.
And because we knew we were expecting, and we were not sure if it's a girl or a boy, so we had to look for two names from the Bible. And so we got the name through the book of, it is in Chronicles. The name is Jeruel. Jeruel means founded by God, vision of God, the fear of God. And then we had another name. We had Jeruel, because when we had done, because we were frequently in the hospital, when we were shown with a girl, we had Jeruel, and we have another one for the boy. We are still waiting.
The boy
we will unveil when that time comes.
Please.
And so we had also another name. But through the journey, and I saw how the mother was struggling, how the baby was fighting. The second name, I was the one who changed, and now called her Jasira, because I saw the boldness, the courage, both for the mother and her.
Yeah.
So I decided to name her Jasira.
Jasira, a fighter.
Courage and bold and courageous.
Bold and courageous.
So this girl is founded by God.
Yeah.
She is, the fear of God is in her.
Yeah.
And so she is bold and courageous.
Yeah.
Yes.
Wow. Okay. I would like to know, how has Jasira been? After now being discharged to hospital, you have to take care of her at home. Has she been growing well? Yeah.
Okay. First, we really thank God for her, because since we were discharged from the hospital, we were just admitted once.
Yes.
And that was just because of maybe if I could say maybe the weather affected her too much, and by then children were really getting sick.
Yeah.
Yeah, so first I thank God for her health, because people and also the doctors, they have been telling me that with the preterm babies they are very sensitive.
Yeah.
But that one I haven't observed with my girl. Maybe except that time when we were admitted, and since then I haven't seen anything serious from that. So she has been well. Maybe from the side of her milestone is what is making us somehow worried, because we realize that she has a delayed, somehow a delayed milestone. But the doctors are telling us that we are not supposed to say she has a delayed milestone.
Yeah.
Because it is also common with them, with the preterm babies. So maybe that is the challenge I've experienced. But from the positive side, she hasn't been struggling too much as we were expecting health-wise.
There's an expectation you had.
Yes, from the doctors, from the history
people.
of the preterm babies.
Yeah.
So it has kept me somehow strong, because even that has taught me that we are not supposed also to hear from people a lot from what they are telling you. Yeah. But
Or you hear and then you sieve what you want to put in your mind.
Yes.
Yeah. Because you can't also avoid to hear.
Yeah.
Maybe you hear and then you know, this one I will take.
This one I will not. Yeah.
Okay.
So her milestone currently is what is, maybe if I could say, maybe stressing us. We are even going for the therapy, but it isn't in that like dangerous stage that maybe she's not expressing that herself. No, the common things that the normal due date baby could do during that time is we have also experienced from her. Like now moving around, she's in that stage of now taking anything. Like the other day I was giving her food, all of a sudden I just realized that she took her hand and kept it inside the food, and now
They say that the grip of a baby works faster than lightning.
Yeah. So despite the fact that we feel like she has delayed, but there are some things she does that keeps us moving, that we feel encouraged. This girl is growing. Like now crawling all over, I have to run up and down, walking around and just taking water, pouring. Isn't that a good milestone? It is. So those are the things that are making us to feel this baby is not that delayed as we think of. Maybe what we are eagerly waiting from her is maybe just to maybe walk on our own, maybe stand on our independence is now what we are waiting for.
How old is she?
She's now 1.7. 1.7. Yeah. And at least what I've shared, she's crawling, she's moving around. It's only that maybe she fears a lot,
Yeah.
maybe standing on her own,
Yeah.
or maybe expressing
Yeah.
herself. Yeah.
No, she will
You
catch
know,
you.
I even had thoughts, like, now my baby is 1.7, and she has not developed that dependency of maybe standing on her own.
Yeah.
But now the things that she does, I had something very negative in my mind.
Yeah.
Sorry.
Yeah.
But through seeing, I let me just share.
Yeah, please.
I was even wondering, is she developing disability or what? The fact that she hasn't met the milestone.
Yeah.
But now all of a sudden, the way she expresses herself really encourages me.
Yeah.
Yeah, so I'm now positive that one day we will just wake up and just see her
She's
walking
Yeah.
and standing on her own. Yeah.
Okay, so Hargreaves, have you found yourself being tempted to maybe compare Jasira with some children of her age, and maybe sometimes feeling a bit low about what Christine has just shared about some delays in some milestones?
I think that one has been a reality because I think the circle we are in, the circle we are in, we can count like just that time that we gave birth. We have we can count even more than 5 to 10 children born around the same time.
Yeah.
And most of them, if not all of them, our baby came first.
Was born first.
Was born first.
Yeah.
So there is a lot of that temptation that you see, like this one just came, this one now is walking. This just came, he's walking and running.
Yeah.
And this just came and he is even speaking.
Okay.
And okay, one of the good platforms we have in church, we call it MAP, is whereby now people who are married around the same time, they're in a group where now they do more of peer counseling to one another. And in that MAP, so we have children. You can see this one.
Yeah, because you are married at the same time.
Then we see like this one in the same age, or this is and you see the milestones. But you feel a bit challenged, you feel a bit discouraged. But what has really kept us going is when we look back the journey. This girl was born at 1.2, and then she dropped down to 900 grams, and then she peaked.
Okay.
So when we look back, we remain sober.
Yeah.
We are sober and we are grateful to God.
Yeah.
Even as my wife has shared, of course we have had some challenges of health and the like, but God has been faithful, and friends has also been there.
Yeah.
And so we look back, we look at the milestones, the celebrations, then we are sober.
Then we look ahead.
Yes.
Yeah. And maybe also to ask, is Jasira in any kind of maybe a special diet, or she's feeding normally?
Not really a special one, but we are still mashing and blending food for her at her age, and we are still training her to be able to pick the food on her own. Yeah. So that not really a special diet, but that one that is the case for now.
Oh, that's okay.
She doesn't have any form of, we say, yet special needs, special complications at the moment. Only the delayed milestones. Yes.
Okay. So, Christine, now having gone through this, how are you looking forward to the next babies?
Okay. Of course, I'm really suffering. I'm still having trauma of getting another baby. But now, considering the fact that I suffered that preeclampsia, the doctor had already shared with us or given us an advice that maybe when I conceive again, for me not to experience the same thing that I had experienced earlier. So I need to start early, maybe checkups, early checkups.
To work with a gyna, maybe
from the word go. From the moment I realize that I'm pregnant, I should immediately take a step. But But also, I was told that pregnancies are very different.
Very different.
Very
Even
different.
children,
yes,
different.
very
Yeah.
different.
Yeah.
So maybe I had experienced that one, and maybe my second baby I won't experience that.
Of course.
Yes.
It's just for caution. Yeah?
Also, with the high blood pressure, I'm not suffering from high blood pressure. It was just through the gestation period is when I developed. Actually, it came at third trimester. So also that one, somehow it's encouraging me, but I'm still suffering from a trauma from the experience. I really fear. I really fear, but but I was also advised to maybe to get a help from a therapist.
Okay.
A therapist. Both of us. It could help us at least to be sober psychologically, so that we will not fear this journey.
Exactly.
Of course, with the fears, considering the baby being too delicate, I could really feel like we'll really manage. And also the fact that I was told the story behind the preterm babies, that is one of the main things. Even the Google, as in you Google about the preterm babies, the Google and the people and also the doctors could sometimes encourage or maybe discourage you. So those are the fears, the talks, the doctor's reports, the history of the preterm babies, and also the way the birth weight and the milestones. Those are the main fears I had.
Telling you?
They were telling me that, if you don't look after this baby well, this could happen. If maybe you do this to this baby, maybe like exposing the cleanliness, if you don't apply this cleanliness to the baby, this and this might happen. So those are the fears. Will I meet the doctor's need towards this baby? And with following the instructions and maybe whatever the doctor was needing from this baby, it's what made our success.
Okay. Maybe I just want to add like two to be specific. One of the things that we were very fearful when the baby came was because I think my wife even said it. Every part of the body is there. Because with that fear of this baby has come early. So there's some part of the body parts that could be missing. So we were afraid, is every part of the body developed? That was fear number one. And then another fear that we really need to overcome now is we fear to have another baby, especially for my wife, because of the experiences that no one wants to go back to the hospital, stay there for 2 months.
Exactly.
And then you are not sleeping. You are on and off. So the fear of now having another child because of the past experiences. Me, the doubt, the questions I had was, where did we go wrong? So that now, the pregnancy did not reach the term. So that was the fear. I could ask, where was the problem? Yes. Why this? And then even when we went to the hospital, we were telling the doctors, in a way, can't you do something so that even now the day zipushiwe kidogo? And so like now she is at 29 weeks, 30 weeks, 21/9. So at least another 2 weeks. So that now is another 2 weeks or 3 weeks. But we had nothing to do about it. Yes, the question was, why this? What can we do? Ama, where have we gone wrong?
Ama tulikoseana.
Hey.
Okay.
Okay, from my side, I was whatever I experienced in the hospital and the people I met there, I met older women than me who were suffering the same case that I was suffering from. So I was asking myself, I'm this young and I've met people here, women here, who are a little bit older than me. What has happened to my body? Or am I big and I don't know that I'm big in terms of age, old. So it really made me ask myself so many questions. I also asked God, what is now happening to me? And I could cry. You know, the phobia and the stress that I was going through made me to be very emotional. Until even the people around me could come and encouraging me. I mean to encourage me, and even just the friends around the hospital, they could just encourage me. They could tell me that this thing is common. It's not all about the older women or younger women. It can just appear to anyone. I was even told that there are some people who suffer even diabetes and during pregnancy. So I should not be stressed over it. It is something that always comes and goes.
How did us now, the society, apart from now your close friends, how did we judge you? As the society, did you come across someone who is very negative and giving you a lot of negative vibes?
The moment I shared with maybe, was it a friend? I think she was a friend to me. And I told her that I'm suffering from high blood pressure during pregnancy. Na niambia, hiyo ni ugonjwa ya wazee. Kwani uko na stress? Hiyo si ugonjwa inafai kukushika. So I'm like, okay. I didn't know that those people who suffer from pressure are the older people, the aged people. I felt discouraged. Of course. And I just replied to her and told her that mimi nimejikuta tu niko na pressure. And nita accept too. Yeah. So see ati I have stress. Mi niko tu sawa. Yeah.
I think for me, it reflected in terms of the milestone, because people who are close asked me the milestone, where is the baby, how is the baby doing, and they are like, now you are really soothing the baby, you are not being active, the baby is supposed to be doing this and this, and you are telling me they are not doing this. So the aspect of we are pampering our baby too much. That's why she's not growing. That's why she's not attaining the milestones.
Such a negative
yes
view. Yeah. So maybe before we just come to an end, which word can sum up your parenting?
I can say I can use this word that we say resilience. Resilience in a way, because you're supposed to keep on moving.
Yes.
Regardless of the
challenges.
Yes.
Okay, and Mom?
The same applies to me. Yeah.
You started by telling us that the first 6 months you were, learning to, each other, cooking together, house chores together, maybe taking a walk. Has this journey, have you ever fought and felt as if you're not agreeing on some issues as your parent?
I think the truth be said, yes, because it is like, it's a new thing.
Yeah.
So there is maybe preferences will a bit change.
Yeah.
Maybe for now, maybe if I'm to share it now, like for me, I am really looking forward in doing away with the blending and the smashing of food. But now the mom tries. We still tries for a few times. You feel like the baby is not feeding. Yeah. So she goes back there.
So that the baby can actually eat.
Yeah. So you find like me, I want this baby
to toughen up.
But the mom
is softy.
Yes, I think that I could share that as an example.
As an example of disagreement.
Yes.
Okay. As we now conclude, maybe a parting shot. Maybe there's someone watching you and she would like to hear. But what would you now encourage someone who is probably going through what you're going through, or actually someone who is also clueless about what parenting can bring?
Ensuring that you surround yourself with the right people, the right company, and God being at the center.
Yeah.
And then knowing that parenting will really, in a way disorient you, because your schedules, the way you used to do things, you will have to be ready to change. If I may share an example, personally in our family, I'm the one who likes to sleep. So the sleeping part
oh my goodness,
will be affected.
Not only in your family, even in my own family. My husband might be watching.
So the sleeping pattern and also the priorities. For example, we wanted my wife to change work.
Okay.
But now because of that, she had to remain there. So budgeting, everything will have to change in a way. Yes.
So we get ready for parenting.
For that transition.
There's a lot of adjustments.
Yes.
Okay. And Mom, what can you say?
From my side, somehow the responsibilities, they become somehow too hectic. But as a mom, you just prepare for them, and also managing your time, and maybe your work. If you're a working mom, you just have to maybe do your level best to meet the need of maybe your baby or parenting. It could be difficult, but you just have to. You just have to. So you take it positively. The responsibilities, the time, the housing duties. You persevere. House chores. You persevere. You should just organize yourselves on how to cope up with them.
And thank you for talking to us and allowing your story to feature today. I'm so grateful for this opportunity, and we will end here. What I have taken away from this conversation is that friends really come in handy. So make the right kind of friends, and they will help you to carry the burden. They will make your burden easier. And apart from friends, trust in the Lord. And the Bible also keeps telling us to trust in the Lord, not to lean on our own understanding. Thank you for watching this show. Please subscribe to this channel if you have not yet subscribed, and hit the notification button so that you'll be notified every time I upload a new video.